I have to say it loud, he saved my dad's life, and since that day I believe in this man, and I share a good energy and the experience of not only my family members, but a lot of people who came to your clinic with cases that are undescribable and unbelievable, and those treatments made their life much, much easier. He's all yours. Thank you.
Thank you, guys. So first of all, thank you for sharing your beautiful Sunday. Well, today the idea is just to have a general idea what's going on, expectations. My idea was to do it a little bit more medical, but they were pushing a little bit more towards anti-aging. So I hope I meet your expectations. Still, if we do not touch a specific subject you're interested in, at the end, we can have a sit down because we all have cousins, sisters, and somebody that might be able to be helped with this. We're going to talk about stem cells, but for the everyday person, the average Joe, you don't have to be on a wheelchair or having a life-threatening diagnosis to think about, am I a candidate or not? Because everybody's aging, and there's always a way to make you feel better, have more energy, to get the most out of this vehicle, which is our body. Depending on the person, well, there's a potential to get them into better shape. Why we age if we have stem cells? Why the machinery breaks down if I have a system that should fix it? Nobody explains you that. What types are there? Where do you take them from? What is the potential actually, the real potential? Not the hypothetical, theoretical, in the lab potential, which is different, that is injected inside of you. How much should you get? I have a cousin that has this issue. Could it help? He had stem cells in Costa Rica. Why didn't it work? Remember, aging, it's a process. It's not a thing that suddenly happens. You were young and you hit 65, boom, you're old. The aging process doesn't start with gray hair. It doesn't start having, sunspots, wrinkles, and there's more specific results we can get. Should you invest in this type of treatments or not? This is why you're here, to make it real. We're similar, we're not the same. Biologically, genetically. At what hours does our body replenish our stem cells with our adult stem cells that we do have? For doctors, you wanted to keep on working also? I took the shot in Costa Rica, Panama. Okay, perfect. Why I still have issues? Everything is about perspective, even aging and health. I'm going to focus a little bit more in our area, and beauty. Even just being under the direct sunlight too much nowadays could damage a little bit here. Just enough that one day it won't be able to heal here to replicate and give you new fibroblasts so you can produce new skin when you're going to the spa and getting a wonderful radiofrequency treatment. And once upon a time, it worked and you look wonderful, luminous, shiny, smooth skin. And now you have to take 3-4 sessions. Now you have to, instead of once a year PRP treatments with our estheticians, I think you have to go like 6 months, and then eventually every 3 to 4 months, and then it kind of doesn't work. Man, I'm going for more Botox shots. I'm getting more dosage, more shots, and I look the same. Hyaluronic acid. 1 molecule of hyaluronic acid traps 8 to 12 of these. Heard about free radicals and why you need antioxidants? Well, because the damage is at this level. Are you seeing the person, the wrinkle, the saggy eyes? My back hurts, man, I just can't take it anymore. Are you just seeing that? So depending where's the damage, it's the actions we can take or the repercussions we're gonna have. And that's where anti-aging medicine comes from. It's not mumbo jumbo, it's not hocus pocus, it's not magic. I would love to be magic, just boom, you're young. It'll be wonderful. It's a science, specific science. Our job as anti-aging physicians is where I'm gonna see you. When do you think you should be coming? When you're here, when you're here, or when you're here? Regeneration means fixing. Fixing is not transplantation. how much tissue we can regenerate, fixing, maintenance, and how many organs still we can kind of get boosted to start working again. The why you came to see me, the bum knee, the bad back, the migraines, the loss of memory that we've been troubled with so many years. How many stem cells are they going to inject your butt in China in international waters when an abortion product where you're going to pay $25,000, $1 million, and you want to fix 40 trillion? Does that seem logic, guys? It doesn't add up. How many different types of cells do you think that we have? Hundreds. Okay, yeah, but hundreds more limited. It's between 200 and 300. Or which one is the one you have damaged and specifically you want to help improve, maintain, fix, or regenerate? When you talk about stem cells, where's the damage? What do you want to fix? Those specific organized cells that work in a specific manner? A bunch of those that work together? Or your doctor needs to know. How are we doing till now, guys? Too heavy? Your body's having a hard time compensating the production of some neurotransmitters, and you're feeling depressed. We're always stressed about something. You have the power, not big pharma. Here's a secret. The number one cause of booster shots in healthy patients, let's say after a year, year and a half, wives call me to say, Doc, hubby needs a reshot. And he gets calmed down, he gets romantic, back in the mood, able to perform, stamina, the whole thing. Amazing. Q10 to boost the function, not 10 milligrams, guys. Not Costco 30 milligrams, 240 caplet. Between 400 to 800 milligrams a day. That's anti-aging dosage. Antioxidants, yeah, of course. Centrum dosage doesn't cut it. It has everything from A to Z, bad quality. It does have everything, but in which amounts? 30 milligrams? That's not an antioxidant. That's normal nutrition needs. The aggressiveness of the cancer, 50,000 to 100,000 units a day. Cancer is one of the most aggressive cellular damaging diseases out there, where basically you beat the rate of the fixing system of the body. I fix an inch, you destroy a meter a day. So I needed something to stop, to give me time. We're getting there. Monoclonal seemed pretty interesting. Dietary looks pretty cool. pH, I don't know, a little bit more balanced pH looks promising, yeah, but now to apply it. Because alkalized water is not the way to go. The lemon in the morning with the sodium bicarbonate, that's not the way it goes. 5 to 10 minutes, well, you need to send a little messages, calls, go to the bathroom, take some water, and to write me your specific questions if I have not touched a subject in particular you want to know about. Okay, what is the problem? What is the diagnosis? Why are you thinking of getting stem cells? Because also, they don't produce all the cells. Remember, we produce 266 different types of cells. This is below optimal quality cells, so it doesn't sound so aggressive that you're wasting your money. If you could get 100% regeneration, you're settling for 50, for 10. Doesn't mean it doesn't work. We have embryonic and adult. Embryonic is placenta and umbilical cord. You were asking over there. And you were asking over here, should I or shouldn't I keep cryogenic the placenta and the umbilical cord of a newborn baby child you're going to have in the family? Which cells they're going to take? Why are you going to pay for that, the cryobank? We have two types of cryobank. The ones that have the tissue, the whole thing, part of the placenta and part of the umbilical cord, the cable, and the blood inside of the cable. Frozen, deep frozen under minus 196 Celsius in liquid nitrogen. And when are you planning to use the cells? Well, my kid is healthy, thank God, good. Well, somebody else in the family might use them. Maybe I have an issue with lower back, for example. Okay, when are you planning to use them? 5 years to give maybe a chance, some wiggle room for the baby if he develops some disease. Okay. This is the problem of keeping deep frozen in liquid nitrogen. That's why they charge you monthly, because it evaporates a lot. It's very, very pricey to have something deep frozen in liquid nitrogen. The problem is each year will dehydrate the tissue 10%. In 5 years, you're paying a rent for something that is already going to lose 50% of the probability of health. If you have problems with anemia in the family, it's a good option. If you want to heal the spine with the cells of the blood, blood gives blood. If you have issues with your liver and you're having bleeding, like we know a patient, could help. If you don't want blood transfusions, this is safer. It's better. Doesn't give allergy. There's no rejection. You don't have to take medication to, So it has good wiggle room. How much are you going to pay for it? And remember with that when you need it, that you have them. 90% of the patients that they're paying, the rent, and an emergency happens, they take them to the ER, they do the surgery of their standard, normal allopathic treatment, and they forget they're paying that. We're going to use not the blood inside the cord. We're not going to milk the cord. We're going to use the chunk. That works different. The chunk, the cord, you also have a lifespan, like 5 years-ish, because of the type of cryopreservation technique. And we have 2 types of banker, the one who milk the cord and the one to keep the thing. If I have to choose, I'll keep the one that has the live tissue frozen, the whole thing, because you get more cells. Not only the blood inside the cord. You get the cord, the blood, and the placenta. But if you have specific needs like intravertebral disc, they won't help you because they do not produce intravertebral disc, even if I stimulate them in a lab and put growth factors on. If I have Alzheimer's disease, you won't get better. If it's mixed dementia and you have low blood flow to the brain, yes, you will get better because it produces more blood flow. So anything related with blood flow, you will see an improvement. Fractures, yes. If you remember you have the thing, and they can get them to you. The cells of the umbilical cord that has fibroblasts, which is a specific cell that will give you chondrocytes that produces cartilage, or osteoblast that will produce bone, and they inject it in the fracture, and it's not moved. You don't need surgery to, reattach it or put, plates or whatever. It will heal around in a month. But if you want it for osteoporosis, it's not going to hurt. It's not going to help. There's too many factors involved. It's better than the bone marrow, absolutely, because they're newer. They have maybe a couple moments from birth. So they're not old. They're adult stem cells, but they're not old. And they're not damaged. And if the mom didn't get exposed, hopefully, to a bunch of other stuff we got exposed during a lifetime, they should have better, higher quality. So if you have to pick between fat cells, bone marrow, or umbilical cord, go with umbilical cord. But still, you need to know for what and how many. Because once you defroze that tissue, you cannot refreeze it again to reuse it. Now, the placenta. Placenta will give you blood flow is an anti-aging organ like no other. I don't know if you ever heard about stories where, sadly, in an accident, the mother dies, but she's, pregnant, and they get to the mother like 6-7 hours after, do the surgery, and the baby's fine. Have you ever heard stories like that? Or 2 hours after, or 3 hours after. The function of the placenta is to keep the product alive in specific conditions. Not all placenta produce the neuroendocrine cascade to keep the product alive because that's an excellent boost. But you get like 2 years to use it for anti-aging, and you still lost like 20% about the potency of that. I hope the clinic you're paying to doesn't go broke or out of business when you need it. In fact, it's very known that they throw away the tissue and they bring other compatible tissues, just like transfusions.
Instead of giving you your own blood that you put in a fridge, well, they ask for donors. They're like transplants. They, like under the rug, that's a little bit of what they do because it's easier, it's cheaper. If you have to freeze 30,000 placentas in liquid nitrogen, it's very pricey. What is a stem cell? What's its function? Basically, is a standby cell. It's just going to be there. This is like a student who just finished high school and doesn't know what to do. He wants to go to the university and do some type of, I don't know, maybe bachelor degree, something, but doesn't know what to do. It's just a student. Doesn't know which kind. But for example, they say, you know what? There's an opening in law school. And he gets into law school. So he turns into this high schooler and goes all the way to go transform himself into a law student and could even get specialized, but usually doesn't go back. Or maybe he's not a lawyer and he's an architect and doesn't go back to being like an undefined student, but general branch. No? Once he's super specialized, well, the idea is either you keep studying or you go work, right? Basically, it's with stem cells. Mesenchymal stem cells come from the umbilical cord chunk and will give you bone, cartilage, tendon, ligament, synovia, which is the bag, will give you fat cells also. Depending stimulation could potentially give you muscle, but usually gives you smooth muscle. So that'll be more for everything that is in the GI. And if you have Huntington, sadly, they're not going to produce the neurotransmitter you need. And if you have Alzheimer's, they don't do memory neurons, but they do a little bit of the neurons that go in the nervous branch that could be pinched in a nerve. Embryonic. The moment we have different types of embryonic stem cells. It's divided of how many tissues you can get out. The ones that give the whole human being are not used for medical treatments. They're called totipotential. A whole human being. That's used for cloning. We don't want a brother that looks like me. Like the movie The Island, you know? No, we don't want that. Okay? We let them mature a little bit more. So we get parts of the body, not the whole body. Right? So we got pluripotential embryonic stem cells. This happens like between the 12th day after the implantation of the fertilized egg. But it's a headache. Till now, it's a conundrum that it doesn't have an answer for human use, like we were speaking. Because if I take one of the cells, I'll kill the potential baby. Because it's so little and so fragile that I'm going to burst up the premature placenta, and that kid's going to die. So it's prohibited till now. It's in a standstill, other than international waters in China, where they're taking abortions and they're doing this. Then we have the mesoderm. Mesoderm is everything that is muscle, that holds the body together. Bone, tendon, ligament, joint, cartilage, collagen-related tissues. This has been taken from animal. It's called allogenic stem cells. Xenoallogenic stem cells. Different species, different source. Not me, not human. No allergy, why? This is a gene that maintains the cells in a standby process. The moment you let it mature a little bit, it turns off that gene because it's gonna divide. You don't need more clones about that cell. You need parts of it to keep maturing, differentiating left side, right side of the baby, a heart, 2 lungs, kidneys. You need different parts. So if this gene keeps too active, it will be all the same, like a little ball. The way we get different inside the belly of a mommy is like that. Adult stem cells is completely inactive. All cells are going to be different. Aging. Yes, it has aging in a cellular language. It's dividing. Each division, it's getting one generation older. I told you, 42 generations of a cell is usually the lifespan. Starting from the day we got conceived, not when we started to get stressed. Adult stem cells, from the day of birth, they're very old. In a cellular language. How we measure the age, each time a cell divides, it gets kind of stuck, a piece of it, when it divides in the mother. Here, it has an enzyme that is very high, and here is very low. This is the way you can absolutely be certain these are young, these are old. This one, interesting, the placenta has a factor called leukemia inhibitor factor. If you have placenta and you have a patient with leukemia, you will inhibit leukemia. And boom, he's cured. Isn't that sound wonderful? This one doesn't produce that growth factor. Why you feel high on energy, why you produce more muscle, why it's that potent anti-aging organ, the placenta, because it has growth factors. This one's usually helps stimulate the production of cartilage, tendon, ligament, joint, vertebrae, and nerve ending. So placenta potentially is something good. Types of cell you can get out of the ones that come from the embryo, and including placenta, umbilical cord, 260 types. Not the 266 anymore because you left it 12 days to mature. The body has a sensor, has a system to know what's yours and what's not, what should be inside and what should be outside. It's called an organ, the thymus, that is retrosternal, right here in the chest, that is big when you're young, and as you get older, it gets really, really small. The function is to produce T cells, lymphocytes, so it's an immune system, and there's a specific cell called dendritic cell that stamps, does an inventory. Heart, eye, lung, back. That's why you know there's 260 stamps. So if you're going to get stem cells, or either are from placenta, umbilical cord, and the blood of the cord, or embryonic and animal ones. But if the patient's 95 years old, has Alzheimer's, has osteoporosis, has arthritis, has back issues, doesn't walk anymore, doesn't talk anymore, barely eats, malnutrition, dehydration, is taking around 55 medications, and you want her to recover, and I need studies, I need a bunch of stuff, and the answer you kind of intuitively know that it's going to be very, very hard.
Now, what's the source of the stem cells?
We were answering that. We have all the sources. We have animal labs, we have human labs, we have a bone marrow lab, we have the surgical room to take the procedure from the fat cells, which, look, I don't like it, but some patients come to me and say, this is what I want. And it's not what you get. We have exosome, we have 14 labs we work with, so every option's on the table. And depends a little bit what the patient's looking for. If they give us the opportunity to suggest, I would say, look, for your issue, your age, your damage, I would suggest A, B, and C. What's your budget? And we'll go from there. Now, if they are, I want a umbilical cord, I want for my kid, okay, this is we can, deliver their kid here, we will froze it here, this day we'll do this, I do packages where I mix the type of cells so we get the most results. We need 260 different types of cells to heal. Mesenchymal stem cell will give you something related with collagen. Bone, tendon, ligament, joint, some skin, membrane, a little bit of bulgy discs. Best source is the jello around the umbilical cord. It's called Wharton's jello, right here. Other sources in adult stem cells would be bone marrow, where you can get these. I take a sample, I will put different growth factors to try and force them to turn into bone, cartilage, muscle, tendon, ligament, in fat cells, whatever you need.
So can you regrow a leg?
Of course not. We're talking about cells. That'll be transplantation. Eventually, we will do biomechanics. But that's replacing. This is fixing, remember. We started off fixing. Non-regeneration means I'm fixing. This is maintenance. Not the hurricane came, I lost the house, we have to build a new one. From scratch. It would be great. Eventually, could be, potentially, there's an area, but that's tissue engineered. It's different. We have placenta, umbilical cord, and the membranes, and also the amniotic liquid has also stem cells. So not only you need to pay forever and ever the rent. Have you ever heard about amniocentesis for diagnosis for the baby? When they take the liquid out, it has stem cells on it. So if you talk to the doctor, knows the technique, there's a way to inject them, for example, to yourself. I have issues with the knee. Put them in the knee. Ask them so. Instead of throwing them away. Or part for diagnosis. And whatever you're not using, the excess will get them to good use. They're there. Okay. These ones are only for adult sources. This one is placenta, umbilical cord, membranes, and the blood of the cord. You have, from the blood of the cord, all the red cells are the white cells and all the platelets. And they're different types of immune cells. Easy, right? Mm-hmm. So, mesenchymal, you're going to have bone, cartilage, fat, fibroblasts, hepatoblast, that means liver, neuroblast, but not every single type of neurologic cell. Some of them. For example, memory and movement, not. Stability, not. So you don't apply directly and stimulate with neurotrophic factors, you're not going to reproduce cerebral lobes. But you could do better in a nerve. So for neuropathic pain that is very local, yes, of course, it helps. Now, myocytes, tenocytes. So this would mean muscle cells and tendon cells. So for example, an athlete that had the rupture of the Achilles tendon, you put mesenchymal stem cells out of the umbilical cord, you inject them directly after the surgery or during the surgery before they close. Man, the healing power is going to be amazing. Endothelial cells. Endothelial cell is not a stem cell, but it works like a stem cell. Endothelial is the inner part of the circulatory artery system. If you stimulate those cells, you liberate more nitrous oxide, so you'll have more oxygen, more blood flow. Helps for memory, helps for the heart. So what they are doing, injecting stem cells directly in the heart after a heart attack, usually is endothelial stem cells that come from mesenchymal. A different part of the cord. The cord has two arteries, one vein. They cut a chunk of the artery, they isolate the cells, and they inject them in the heart. It's a little bit more technical, but so you know there's something behind that. Okay. So you can get cardiomyocytes, you can smooth muscle, and myofibroblasts. They used to think that the muscle only gets scar tissue. You can't really fix it. They found out that there are special kind of fibroblasts that come from the placenta and the umbilical cord that under the right growth factor, you can reconnect the strands of muscle. But it does better with that. The problem is, from this, get it to this, and enough of this, and where you're going to apply them. Potentially it helps. Fibroblasts are not stem cells, but young fibroblasts that come from connective tissue of the umbilical cord do wonders. Because fibroblasts, as you know, produce collagen and elastin. Imagine the youngest kind of fibroblast that produces hyaluronic acid, like that smooth baby's bottom skin. That's where they come from. So if you're able to collect them and apply them, man, that's for anti-aging. That's wonderful. Smooth muscle and pericytes. Pericytes are cells around the capillaries. Anything that's far away from any blood vessel, this is micro. Further away than 200 nanometers, it's something super tiny, will die. You get atrophy, you get scar tissue, it doesn't grow. Problems with neurologic problems, you have to be on it. Parasites, not parasites, parasites, to create more capillary tissue. When you go under the hyperbaric chamber, you're stimulating pericytes and endothelial cells to create more blood vessels. More oxygen, more nutrients, more cells get to the injured area. Okay. This would be bone marrow. What you can get out of the dental periodontal ligament stem cells. You might get dental structure, maxillary, you get mandible, you get from the dental pulp a little bit of dentine. But what experience we have is that in the lab you can create it, but when you inject it, you don't produce it. So this kind of drives dental doctors kind of crazy because it works or it doesn't. The bone, yes. But the shininess, the renewal of the whole tooth, no. It's too much far down the road of differentiating. So it doesn't turn back into. You might get a tooth eventually in the lab, and we might replace your old tooth for a new tooth. So that's tissue engineering. It's heading there. But we're not there yet. There's also, pancreas beta isolates that they're taking from newborn piglets. They're stimulating, getting more. Once they have a bunch, they re-injected them directly in the pancreas in a procedure called CEPRE, that it's already kind of delicate. And they're regenerating parts of the pancreas. But that's tissue engineering, with different. Okay. What else? This is, remember, I told this is for doctors. And we have like half of the audience is doctors. So if it's too much, just block us out.
Doctors.
Pluripotent stem cells. More potential to create a bunch of cells. Down here, less potential to create new stuff. Less specific, super specific. If I only put these stem cells, it's so hard to really hit them full time. Because a patient is, what year? There's too much factors. You just saw in the stress. It's so easy to miss out. And the body's super smart, and it's going to say, look, you're putting it for skin and beauty, but you didn't know. You have one kidney that is not functioning as it should, and you don't notice it because you have two and you're compensating. So if I only pull you up with this, the body's going to choose where they're going to go. And usually they go to organs to maintain life support. And usually they don't care about your knee, they don't care about your hand, because you can live without limbs, but you cannot live without a heart. You can live without eyes, you can live without an arm. So it's kind of hard, it's kind of harsh, that truth about cells. Where's the stimulation road taking them? How about we put some of these that can produce every single kind of cell. We produce kind of the middle ones. They already finish up a bachelor's degree, but they're not super hyper specialized. And let's put the brainiacs, the ones that has doctorate, so we don't miss a thing. If I miss it, it would be by 5 to 10%, and I can wiggle my way around it with supplementation and other anti-aging techniques. So it's harder to miss and give you a bad result. This is why we're getting excellent results, and 99% of our colleagues are not, because we are so narrow-minded. The muscle's the one you need. Let's put muscles then, but the body's smarter than you and me together. And maybe they're going to the lung, to the smooth muscle in the lung, because you have a bunch of other muscles. And that's why 50% of most stem cell treatments, you don't get what you want. So how about we this is the loophole we kind of found in the way the body reacts. So most physicians just going crazy. They tried everything in the book, including stem cells, directly injected in the stem, in the brain, in the lung, hurting people, getting you $30,000, $50,000, $100,000, and the results are mediocre.